Greetings and welcome to the Southside Help Center show. I'd like to thank everyone for tuning in and give you an opportunity. If you have any questions for us, please give us a call here at the station. This is a live call-in show. Our number here is 312-738-1060. We got Miss Shauna Mitchell over there on the phone, so please put her to work and give us a call here at the station if you have any questions about anything that we're going to talk about. And again, we'd like to thank everyone for tuning in. First, we'd like to pay homage to our founder, Miss Betty Smith. She founded the agency back in 1987. This is our 25th anniversary. And let me say that again. This is our silver anniversary. And this is 25 years for non-for-profit. That is a long time. And the only way that we've been able to do that is with you, the community. So we thank the community for allowing us to serve you for 25 years. So this is our 25th and our silver anniversary. And we'd like to thank our founder, Mrs. Betty Smith, for having a vision and for allowing us to be a part of that vision for 25 years. And we also would like to thank our executive director, Mrs. Vanessa Smith, who is now leading the organization. So we'd like to thank her as well for allowing us to continue that vision. It is so important that as a community that we have visions in our communities, because for so long without a vision we have no direction, and we need direction in our communities, and we have to continue to support organizations like the Southside Help Center. If you would like to support the agency, please check our website, www.southsidehelp.org. Check our website. It'll give you more information about the different programs that we have. Today we're going to go cover some of the programs we talked about before, and then we'll get into our guest, Mr. Maxwell. So just give me 1 second, Mr. Maxwell. Let me just cover some of the things we've covered in the past. And one of the things we've been focusing on a lot is our youth, because it's so important that we get the message out there to our parents to get those youth into the center so that we can continue to provide programming for them. I often think back when my sons were younger. I had one son that he stayed in the stuff. So with that, I had to keep structure for him, and I always say, help me to help you. So whenever I was at work, I made sure he was either in school or after school program, or playing football, playing basketball, playing lacrosse, just something. So as a parent, we need those support services in place, and the Southside Help Center has been providing those for about 25 years now. And we currently have after-school programs that deal with homework. We got, this is the one, and parents, please mark this. We start in a drum line, and it is going to be phenomenal. We have Mr. Mark Schaefer, who's going to head that project up along with our mentoring program. So it's important that we continue to provide quality programs. We also have a dance program coming to the center. If you would like more information about those two particular programs, please give Miss Erica Dawson a call. The number is 773-445-5445 if you'd like to get your children involved in some of the additional programs that we have for our youth at the Southside Help Center. So please, please, please take advantage of these programs. And I say this all the time, that we often, when our kids are not doing constructive things, we want point fingers. So now we have an opportunity not to be a finger pointer, but become a part of the solution as opposed to a part of the problem. So parents, get those kids in there. Parents, come and check out the programs and see what services we're providing for your kids. So please, parents, support the programs that the Southside Help Center has to offer. Last week we talked a little bit about re-entry. We talk about our re-entry program. So we want just so many, a wealth of knowledge, a wealth of programs that we've been covering over the last maybe 7 weeks. We got another 8 weeks to go. This is the Southside Help Center show. So again, we'd like to thank everyone for tuning in. But I don't want to take up all the time talking about just those programs, because one of the things that we've been able to do throughout the 25 years is collaborate, where we can get together with other community-based organizations or other entities that are providing quality programs. And this information is so vital within the African-American community that we get this information. And this is when people ask questions all the time. Well, this is an opportunity to get some of those questions answered. If you have any additional questions, please call the station, 312-738-1060, and we're going to put Ms. Mitchell to work over there. But my special guest, and I'd like to thank him for, I promise you, I really would like to thank him for taking this opportunity to come on to the Southside Help Center show and talk about what we call, let him say it because I have difficult saying it, but we're talking about couples, partners, one being positive and one being negative. Give me the official term for what it's called.
The official term for that is called a serodiscordant couple.
A serodiscordant couple, and that simply means where you got partners, one who's negative and one who's positive. And one of the things that we've talked about, or we get a lot of questions about, is people ask, if you're HIV positive and you have sex with someone who is HIV negative, will they become infected on the first time, this and that. So this is an opportunity for us to have a discussion surrounding positive and negative individuals who may definitely be in contact. So let's just talk a little bit about zero discordant couples.
Right. And I think that sometimes we've made it a clinical word.
Yes.
Zero discordant. When I think that on a fundamental level, it was just someone loved someone else.
There you go.
Then they found out down the line that person's status, but it was someone maybe they liked. I mean, sometimes we're in conversations where we find ourselves liking people before we know all their history, all their past, everything they've been through, who their exes are, and then we fall in love with a person. And then that person reveals to us, well, I do have an HIV, or I do have a chronic illness, diabetes, cancer.
Yes.
And those things can make us uncomfortable immediately. So I want you guys to feel really comfortable at home to feel free to ask those uncomfortable questions, because we understand that it's a big difference. It's the same thing a lot of with race. Sometimes we have issues around one being black, one being white, or in our culture can be a lot different. We can be the same color, but that can be some of the same questions we have sometimes. So.
Absolutely, and I say this all the time when we start talking about it's not who you are but what you do that puts you at risk, and we start talking about it's so important that we don't label things, and it's so important for us to I say get into a relationship as opposed to getting into a sexship, and that means that we have to get into where we start to build foundations, and that's across the board. It doesn't matter if it's man and woman, if it's a woman and woman, man and man. It doesn't matter across the board. We have to get into what we call relationships as opposed to sexships, so that we can talk about the uncomfortable things that we're talking about today. When we start talking about partnership, when we start talking about HIV status, and how important it is that people get tested, why they need to get tested, and it's of major importance. Talk about that a little bit. Why is it so important that people get tested?
Well, I think that the first piece is that as we begin this whole conversation around loving ourselves, and I know you guys have been really awesome about talking about how to take care of yourself in condoms, that part of that conversation is say, hey, how do I even know my status? And if I do not know it, can I effectively say that I do love myself? Because we understand that there's a little fear behind by even wanting to know your status, because we understand that society as stigmatized from sometimes even sex. You're not married, you're gonna catch it the first time you get. We have stigmatized a lot of different things just that we do on a very regular basis. But I think that in knowing your status, the benefit behind that is that a person gets the right to, one, get treatment, and you get to effectively be able to take care of yourself. But the biggest piece is that you have the ability to stop the spread of HIV by knowing your status. If you are positive, you can say, wow, I came in contact with HIV, I've been exposed and infected. How can I personally stop the spread of HIV? And disclosing and being in those relationships, those serodiscordant relationships, that's one of the critical pieces about those relationships is the disclosure. Is that this one person felt comfortable enough to say, wow, I know it's hard. I know society says I'm nasty and says a lot of things about how I caught it, but I do have it.
Yes.
And to take that stigma off how people catch it, what they do to catch it, where they caught it, instead of that they are living with something. And that they still have the same needs as you, as to be in a relationship, as you said earlier about a sexship and a relationship, that we still have needs, no matter what our statuses are, and those needs don't change.
That's right. There's three things I want to make sure that we cover. One, I want you to acknowledge the agency that you're working with, so please forgive me. We talked about Mr. Maxwell, but we definitely want to talk about who Mr. Maxwell is currently employed by and why it's so important in terms of our collaboration and partnerships. It's majorly. Give me a pen and just talk about just give me your age. Tell us your agency.
Gotcha. I work for Brothers Health Collective here in Chicago, Illinois. Pardon me if I sound a little country. I've only been living here for 3 months. I'm from Memphis, Tennessee. At Brothers Health Collective, I'm the health and benefits navigator. Okay. My specific position is to really help people that are positive be able to navigate the system that to getting into treatment, to make sure that they get all the services they need, as well as to find out about any benefits of like Ryan White and ADAP, and how to make sure these people effectively get into care. So and there's a lot of other stuff that go along with it. But
if they wanted to get into directly in contact with you, who would they need to contact?
You can call me at the office. Actually, my name's Antoine Maxwell again, and my number is 312-226-0050.
Okay. And then the other thing I wanted to make sure we talked about, there's some studies around, and this is important. If you have any questions or comments about what we're talking about, please call us here at the station, 312-738-1060. But I know there's been some new studies around dealing with negative positive couples, and in terms of how effective, and just talk about the study a little bit and why that study has really been so important, not just to you but to so many other people in terms of positive negative.
Right, and I think you're assuming PrEP.
Yes, I am.
Conversation around PrEP. PrEP it stands for pre-exposure prophylactic. Okay, and I know prophylactic is probably a word we've been using for a long time. Everything was a prophylactic. Condoms, all these things were to prevent the spread of HIV. So what pre-exposure means is that before a person can possibly be exposed, that we have something in place to stop them from getting infected. So it's before a possible exposure. Okay. So that is a pill that Gilead has come up with called Truvada. It actually was a medication that they were given to HIV positive people, and they found that if they give a person this pill and this person stays on this regimen before being exposed to HIV, that they can actually prevent them from ever becoming infected. It's been a very hard conversation for a lot of people because it said, wait, I didn't know that there was a pill that could prevent HIV infection, and it's been a little uncomfortable. I think even in our field, that a lot of people are a little biased, and people are uncomfortable around it because we always trying to encourage people to use condoms. But I think the best place to have that conversation is when we're talking about serodiscordant couples, and that in these relationships where these two grown adults chose to be together, and one person says, "Hey, I don't want to use the condom anymore, and I'm negative, but because condoms." Aren't as easy, and we understand that sometimes the reason why people don't use condoms is because it's a barrier between us and the way we touch and the way we feel. And for some people, they say, I'm ready to take that barrier off. Same thing women and men do all the time when we say, well, I'm ready to have a child now. That I'm ready to really combine myself with you or really experience you. So for some people, that barrier, they want to take the barrier off, but in that them taking it off, they don't have to become positive.
Right.
We go ahead.
And because we oftentimes talk about why is it so important that people get into relationships versus sex ships, because these conversations need to take place early on, and one of the reasons is because we want to talk about testing and why it's important that people get tested, because if someone tests positive, there's some things that can be put in place that greater reduces the risk from their partner becoming HIV positive. So this is what we're talking about. We start talking about PrEP and other things like that. Start talking about the studies that they've done in Africa where they've studied partners where one was positive, one was negative, and the individual is taking medication on a consistent and regular basis, and how it brings down the rate of infection. And it's so important that people understand what we're saying or what we mean when we say, why is it so important that people get tested? Why is it important that people get in relationships? Because this information needs to get exposed, and that's where you get to talk about my sexual history. That's where we get to talk about we need to get tested together. That's what a partnership and a relationship is so that in the event that you get to the point in a relationship where you say, I no longer want to use condoms, that all of the everything has been exposed, and that's what a relationship is.
And people can make the decision that's based off all the variables. And the thing that I do like that Mr. Cherry said was the thing about a sex ship is that hookup that you just met online, it's hard to have that conversation because you don't know what that person's going to say, you don't know how they're going to feel about it, and it can be really uncomfortable to meet someone and say, hey, I'm HIV positive.
Absolutely.
There's a lot of rejection. However, there may be a little bit more confidence in the fact that I trust you and we've built this relationship. How can I still trust you and protect myself? And that's where we start, that's where our humanity sometimes starts blossoming, and we get the opportunity to say, wow, I don't want to infect anyone. I don't want to, and this is coming from a positive person. I've been living with HIV now for 28 years. I was infected 2 days after birth via blood transfusion. So I personally have witnessed how hard it's been to disclose.
Absolutely.
But even in the hard part, I felt like I had to. So in me being in relationships and some of my partners being negative, I found that I wanted to keep my partners negative. It was my goal. That I felt like, hey, I don't want them to become exposed. And sometimes my partners love me So much that they said, wow, I would even think about being on PrEP. And I had to think about how comfortable I was with that. So, you know, I understand that when we hear that conversation around serial discordant, how uncomfortable it can be. But I think the uncomfortableness is on both sides.
Absolutely.
Because the positive person could possibly feel guilty about what if this pill doesn't work, or what if this happens, and then the negative person saying, but I love you. You know, and so I think that, you know, life sometimes, love in life, some of us have been in relationships, and I think we probably can all call in on that. We've made some sacrifices, and sometimes we don't know what that sacrifice was, but we did it because we love that person.
Yeah, and we need to talk about love and what that really means. But the other thing is, as you talked about, it's really hard to disclose. Why is it so hard for people to disclose? I mean, and you can sum that up, you know, really quickly. Why is it so hard for people to disclose their status?
Well, the CDC said when they first released a statement about HIV that they tried to retract it. When they first HIV came out to the public, we called it GRIS. It was called Gay-Related Immunodeficiency Syndrome, and the CDC has never been able to take away that stigma. That we first called it a gay disease. And so based on the stigma of HIV and based on some of the things that people saw, society can never let it go almost. It almost feel like people, it's like almost the belief system. It's like pulling a steak from a pit bull.
That's right.
That's all people know. Some people say, well, no, it's for the gay people. And so that with that wording, or with, oh, prostitutes got it. Now, only IV drug users got it. And like you said earlier about, it's not what we, you know, it's not
who you are,
but what you are, but what you do. And because there was stigma on people, what they did, we have, no matter how you catch it, it's just, you got it, and you had to do something nasty or detestable or not agreeable for a lot of people. So I think that the stigma makes it hard because we're living with it.
And you hit it on the head when I said sum it up. You hit it, stigma. That's why it's so difficult for people to talk about this disease, because of the stigma that surrounds HIV, and it's across the board. And we have been trying to get, for so long, we've been talking about, it is not who you are, it is what you do that's putting you at risk. It's not a gay disease. HIV does not discriminate. It affects young, old, it affects men, women, it does not matter. And we've been talking more about, last week or last month on the 7th, we did a sex factors, and it was dealing with 50 and better, because one of the things that we noticed that those numbers are going up as well. So people are really getting put at risk, and it doesn't matter that you get to be 50 or older, that if you're out there, and it depends on what you're doing, that there's still risk there. And that's what we're talking about, risk. And we talked about why don't people talk about why they're HIV positive. It is because of stigma, so because of all of those things that surround this disease.
And I think you said it best when you say, oh, they're 50 and older, but guess what? They still have needs.
Absolutely.
Even though we put grandma in a senior citizen home, we think that grandma still don't want to hug every now and then. She don't want, you know, grandbabies to touch her. She might want another man to touch her. You know, and I think we've stigmatized older people.
Yes, we
to
have.
say, oh no, grandma ain't gonna do that, and grandma like, okay.
Yeah, but
you know,
and this is reality.
There.
This is reality for us, and sometimes we get so far from what reality is that we start talking about nonsense and doing a lot of nonsense. And I always talk about my experience.
And we start doing what makes us comfortable. We talk about what makes us comfortable, because nobody wants to hear that granddaddy got a little blue pill, and he came from a generation where they weren't using condoms. Right. And so now he like, oh, I don't know about no condoms. We don't talk about condoms. The only thing we worry about is pregnancy. Right. So based on that generation, and now this new access to relive that moment, we don't want to believe that granddaddy is still having sex.
Yeah, absolutely. We've been talking about the blue diamond ever since Viagra came into play, that it has definitely changed the game for a lot of our senior men, and they have become that much more sexually active. And we do know around the 1st and the 3rd of the month, when Social Security checks and pension checks fall through, that we get a lot more activity in our senior buildings, where we do have a lot more prostitution going on. And I mean, we just keeping it real. You got a lot more women showing up to the buildings than normally does around the 1st and the 3rd. So we have to talk about reality and what needs to happen for us as a community when we start talking about HIV, and how do we stop the spread of this disease, because it is still affecting us disproportionately. We do know that we only make up a certain part of the population, but yet we carry, or we represent the majority of HIV positive. So it's so important that we remember that we have to stay in the reality of this disease. We have to continue to turn the lights on when we start talking about HIV. And one of the things that I did, I went and I did I co-facilitated a training with a member of the city of Chicago. And when we went in, we had I think it was like 16 students, and we started talking about HIV and how it was affecting them. So, I mean, it blows my mind that they know so little about this disease that has been around now for better than 20-something years. And when you look at that, and I always say there's a generational gap there, because those individuals who, when HIV first hit and it was really affecting us, and so often we knew a lot about this disease, and then we look at our youth of today, they know so very little about this disease. And when you ask the questions, you're like, are you serious? You really don't know that. The other thing is I did a workshop on Saturday. I mean, and it continues to blow my mind, because my goal for this year was to work more with our youth, or work closer with our youth. I did a workshop, and I know I had 20-something youth in the room. And when it came to doing a condom demonstration, I asked if anyone had a condom. And out of this entire room of 20-something youth, no one in the room had a condom. That tells me where their concerns is not. And it's not surrounded around HIV prevention. It's not around STD prevention, because out of 20-something young people in that room, and I'm not talking about little kids, you're talking about 16 and better, nobody in the room had a condom. And I was sitting there, but it makes me as a prevention specialist, among other things, it makes me say, okay, how well a job are we doing? What do we need to do differently to get more information out here? We're talking about couples who negative and positive. We're talking about how do we get that information out here and expose it. We're talking about stigma surrounding this disease and so forth. Right. But there's a lot of things that we need to be talking about continuously.
Right. I think what happened is that with the history of HIV, there was such a bad experience of HIV. When we first found out what HIV was, everybody had AIDS. Everybody was having these chronic illnesses. The CD4 counts was under 200. So that generational gap that you talk about was that, oh, wow, we saw with our own eyes people die. You know, we saw their face sink in. We saw them, we saw some really hard things about HIV. HIV diagnosis, even for me, when I was 13, I got diagnosed when I was 13. So it was like 93. When my doctor walked in, the first thing he said to me
was... You say diagnosed at 13?
Yeah, actually, my parents actually found out I was positive. I actually got tested when I was 13.
Okay.
And when they gave me my results, it was like, oh, well, you're not going to be here to 18. It was like, right now we don't know if you should start medication or not, and it was really an uncomfortable conversation. My doctor came in with a mask on like he was in the CDC, like I thought I was on Outbreak, the movie. But those experiences were what some generations saw. We saw the worst part of HIV, where it was a hospice diagnosis, where it was like you caught it and we got to send you over here and quarantine you. But then this other generation came where we started treating HIV, and so they didn't see the death.
Yes,
they saw, oh, these people look fine. Oh, okay. So their priorities shifted, I think, when it came to HIV. And I think that we kind of focused our prevention when it came to HIV, because we were still targeting gays but we never really targeted youth, because we didn't want to address those uncomfortable things that our children are having sex. And those uncomfortable spaces that we're kind of pocketing and compartmentalizing are what's kind of giving breeding ground for misinformation, reinforcing the wrong ways to show for young ladies to express themselves. I mean, it's nowhere there because we don't want to talk about it. It's getting done. So it's not being talked about. We're just going to do it. So
this is what I want you to do. I want you to, this is the Southside Help Center show, but I want you to take advantage of Mr. Maxwell's wealth of experience. If you're listening, he said that he's 28 years old. He was affected via blood transfusion at the age of 2. So he has, and he I don't want to call him a kid. He's a grown man. Don't get me wrong, but I've been grown twice already. So when I say I'm grown twice, that means I'm 21 twice. So you do the math on that. So that being said, I can say that he's a very young man, but his experience or his wealth of knowledge is vast. Take advantage of this. So if you have questions, in terms of not just how he lives, the stigma that he's had to deal with all of his life, call him. Ask the questions, because when the show go off, you'll be saying, I should have took advantage of this opportunity to speak with a brother who is open, who is willing to share this information with me in terms of his life, his lifestyle, what he's had to deal with in terms of his medication, what he's had to deal with in terms of stigma, what he's had to deal with in relationships. it's important that we get this information firsthand, because then you can get it from him and then you can share it. Not only share it, but internalize this information so you can make better decisions about what you want to do with your life in terms of your sexual responsibility. We talk about that all the time. What is sexual responsibility? What is relationships versus sexship? What does procreation mean? All of these different things. We throw these words out there, these behaviors out there. This is an opportunity to take advantage of Mr. Maxwell's wealth of knowledge and experience. I mean, and we say wealth of knowledge and experience, but take advantage of his way of life, or how he's had to live life, and differently, I should say, because, you know, people don't think about people who've been impacted by HIV and how it affects them across the board. And we need to take a look at that, because I see all the time, you know, in my experience, you know, I've had family members, my uncle was infected with HIV. This is how I actually got into it. And he was diagnosed in 1984, and he passed in 1988. But I saw family members just completely turn or completely change, you know, where it was concerned. And I understood at that time it was because of fear. You know, it was very little known about this disease. People were getting HIV and they were getting ill and they were dying. They were dying very fast because of, one, a lack of knowledge, lack of medication, and so many things. There were so many variables at that time, and of course a lot of these don't exist. So the thing we need to talk about is what we need to do to stop this disease, because it is a preventable disease, and what we can do to prevent HIV from spreading further.
Right.
And what we can do, and that's what we're talking about when we talk about couples and partners, and the one who's positive, one who's negative, and what needs to happen. And we talk about PrEP, we talk about, and we're very careful with what we say and how we say it, because we don't want you to be misunderstand any of the information, because HIV is really, really disproportionately affecting African Americans. That has not changed.
No, it hasn't.
It has not changed.
And I think that sometimes when we address HIV, we've kind of given it a really, we've dealt with treatment, we've dealt with how to get people into services, but we never dealt with the fundamental issues of another human being that has an illness, and he's my brother, and he's my sister. And I think that sometimes, because we could never deal with the stigma, yes, we dealt with the illness, but the stigma was still there, the hatred was still there. So I think we have a caller.
Yeah. Well, we'll take the call and then we'll go back to what we're talking about. Caller, you're on the air.
Yes, sir. I watch your show quite often, and I could never get to hear where you are located at.
Okay, we're located 10420 South Halsted. We're on the south side of Chicago. The address there is 10420 South Halsted. You can also go to our website. It's www.southsidehelp.org. And it'll also talk about the other programs. Or you can give me a call at the agency. Our number there is 773-445-5445. And while I'm saying that, let me go to our overhead really quickly and make sure that we cover this information one more time. This is our 25th year anniversary, and we truly would like to thank everyone who has been a part of the Southside Help Center for the last 25 years. And it's only because of you that we've been able to, again, provide services. So thank you for that, and we will continue to live our mission, serving people and strengthening communities. So please continue to be a part of the Southside Help Center and become a part of our 25th year anniversary. Give us a call. Check us out on Facebook. We also do Twitter. Also looking for donations. Again, it's so important that you understand we are not-for-profit. We don't have any money, and we continuously looking for money, and we're continuously and I mean, and really, of course, now it's a part of the mayor's plan. It's number 3 on the mayor's list in terms of prevention, and we truly appreciate that, and we want to make sure that we hold them accountable. It's also a part of our president's plan in terms of HIV and HIV prevention. So, and the only way we can do that is with you guys' support. And although it's there, there's never enough money for it. So if you would like to be a part of the Southside Help Center or make donations, and when I say donations, people always think of these large numbers. If you can get $25, let me say this: we're just investing in a program, this drumline program, and what we're doing now is we're buying buckets and sticks because we don't have money, but our kids need something to do. So we're going to take anything that we can get. So that means if you can donate $5, $10, $20, $25, please do so. And you may not think that that's a lot, but I promise you that goes a long way. So please take advantage being able to help us by providing us with any kind of donation. $5, $10. If you ain't got but $10, $5, walk it in and say, I would like to donate this $10. I promise you, it will be used appropriately. It will go directly to programming, because I promise you, we don't have money, but we need your support to continue to provide programs, and I say for our youth because we truly love them. Is there any closing remarks you'd like to cover, Mr. Maxwell? I truly appreciate you coming on.
Well, once again, thank you so very much for the opportunity. I want to say, how honored I am to be a part of Southside's, with you guys having a 25-year anniversary. That is monumental, and I am grateful that you guys are able to serve in the community. If you ever need me, look us up, Brothers Health Collective here in Chicago, Illinois.
Give me your number.
312-226-0050.
And I'd like to thank Mr. Maxwell for coming on. It was a short notice, but he has been absolutely fabulous, and I truly thank you for that and the opportunity to sit and work with you. So thank you. Again, the Southside Health Center, 25th year anniversary. If you'd like to reach us, www.southsidehealth.org. Did I do it?